Good afternoon. It is 12 noon, and we want to thank you for joining the 48th webinar on Flint Community Webinar on Coronavirus. It is a pleasure to have you here with us today. I'm your host, Yvonne Lewis. I am one of the co-directors of the Healthy Flint Research Coordinating Center. And as we share with you, it is a center that's organized with partners from our University of Michigan Flint, University of Michigan Ann Arbor, Michigan State University, the National Center for African American Health Consciousness, community-based organization partners, and other partners in community from the HFRCC Community Core. We are delighted that we have this opportunity to bring this webinar to you every week since March 20th, 2020. Our purpose for this webinar was to bring a focus for Flint community residents on this global pandemic. And as you can see here, we have wonderful partners that have joined us every week for the last 48 weeks to help us share information with you. And today we also have an added guest from the Flint Genesee Chamber of Commerce that you're going to hear from a little bit later on. But I want to begin today by reminding you, you can put questions in the Q&A today so that our panelists from these various organizations that are behind the scenes ready to answer questions for you. Also, you can give us a call at 810-835-2130. That number again is 810-835-2130 if you want to call in a question, or you can send a question in to info@healthyflint.org. We really want to hear more from you because it's your information and your questions that help guide the webinar, and it's guided this webinar for the last 48 weeks. Today, we've got a great roundtable for you. It's excited to have with us today our standby Gary Jones, who is a community affairs representative out of the governor's office. So we're thankful to the governor for allowing him to be with us on many of these Fridays. Dr. Lawrence Reynolds is with us, who is the chief health advisor for the mayor of the city of Flint. Dr. Deborah Furholder, who is the associate dean for the public health integration at Michigan State University. She is also a co-director of the Healthy Flint Research Coordinating Center. And Dr. Susan J. Wolford, who is the associate professor of pediatrics at the University of Michigan in Ann Arbor. She is also a co-director of the Healthy Flint Research Coordinating Center. So together today, we invite you to listen in on this roundtable. And today included in the roundtable discussion will be our own brother, Clarence Pierce. Clarence Pierce is the CEO of Hamilton Community Health Network, one of the first federally qualified health centers here in the city of Flint. So I want to welcome our roundtable here, and let's get started. Today, we know, is one of the important days in African American history. This month has been set aside to acknowledge the work and the history of African Americans in the United States of America. It started a few years ago by some individuals that many of us may not even recognize their names. But one of the gentlemen we talked about last week, we wanted to bring his name forward to you again, along with Carter G. Woodson, was Dr. Jesse Moreland. He was an educator and a minister and also a philanthropist, did a lot of great work. But he and Carter G. Woodson formed this as first African American History or Black History Week. And then it grew to Black History Month. And Dr. Reynolds is going to open this conversation up to talk about something exciting he just learned about important features or individuals in African American history.
And yes, brothers and sisters, you learn something new every day, and this is proof. I was listening to Michigan radio. Now, you all have heard about pertussis or whooping cough, and some of us my age got the vaccine years ago. But what was not shared was, number one, the work was done by 3 women in a Michigan State Department of Community Health lab. And one of those women was African American, and her name was Lonnie Clinton Gordon. And there's a statue in downtown Grand Rapids. If you go there, you will see this statue, bronze statue of the 3 women. So shut my mouth, as the folks used to say. This was an important contribution in vaccine development because upwards to 100,000 kids suffered from pertussis or whooping cough back in the 20s and 30s. she was trained as a dietitian, and there were some people who would not listen to her orders. And the two researchers in the Michigan Department of Community Health lab hired her because they needed someone to isolate the most virulent or strongest strain of pertussis in order to make a vaccine. And this person did it. So when we talk about we've got nothing to do with vaccines, you know, last week we talked about Onesimus and smallpox inoculation. Onesimus was a West African who was in Boston during a smallpox outbreak and taught the person who owned him how to do it. When we say we've got nothing to do with this, yes, we do. So consider that as we start talking about vaccines, and learn like I did every day. You learn something new in Black history so we can tell the whole story.
So we talk about Black history, but Black history it started then, but it hasn't ended. I'm excited to have at this table today, I think one of our modern day leaders in the work, and that's Dr. Deborah Furholder. I think she started doing this work when she was about 2 years old, but she's been 20 years now as an epidemiologist. And I know when we talk about these vaccines and we talk about trust and concerns about whether or not we can have any confidence in what's going on, as an epidemiologist, she can give us some insights on this.
Yeah, so I'll tell people this from all that we know. And when you talk to people who are on the front lines and you talk to people who've had COVID, and we've seen a lot of our wonderful participants in this webinar who have shared very candidly about their experience with COVID. I understand some of the hesitancy that people may have about the vaccine. And I can tell you it's far outweighed by the risks posed by contracting the virus. Everything that we have for the two viruses that are available. For people who don't know, the Johnson & Johnson vaccine, they have applied for their emergency use authorization, and predictably that will be coming online very soon. The minor risks from the vaccine look like they are far, far superior to the tremendous risks that people face if they actually contract this illness, not just for the short-term consequences, but the real long-term consequences. We're finding out now that people, even who were asymptomatic, have a long-term impact of the recovery process from COVID. So, you know, we're here to answer people's questions, make sure they have all the good information. But I will say, having now gotten my second dose of vaccine, it was not that bad. My good friend Yvonne Lewis gave me good advice to take some Tylenol with a few hours after getting the vaccine. I basically had almost no symptoms. I had my regularly scheduled physical exam the day after. I didn't tell my physician until the end of the appointment that I had just received my second dose of vaccine. And she was literally distanced from me in the exam, in the room, both of us masked up. And she did like this and gave me the virtual high five and said, good job. So none of us can give people medical advice. You should only be getting medical advice from your actual healthcare provider, which is why I'm so happy that Mr. Pierce is on, because if anybody does not have a primary healthcare provider, we've got that available in the city of Flint. There's no reason for anybody to not have a trusted medical provider to answer all their questions and help them navigate the decision of whether or not to get it.
So that gets us to the health equity issue, because if there's not access, of course, we're never going to get to that place where everyone needs to get the care that can have the ability to get the care that they need. So Dr. Deborah, I'm stuttering a little bit because you outed me. This today is the big reveal. Okay. So the reason I was able to share some things with Dr. Deborah is because on Monday of this week, I got my second vaccine. I was determined. I didn't want to be a poster child. I wanted to walk the walk. I wanted to talk the talk. That's okay, Dr. Deborah, because I was going to do the reveal. But I didn't want to share anything with anybody that I had not experienced. I wasn't sure. I had the same questions that other people had. Can I trust this vaccine? What's going to happen? I went through the process. I had conversations with my children. What did they think about it? My son actually told me, Ma, if you don't get the vaccine and you have an opportunity, he said, you are one of the biggest hypocrites I know, because you're telling people that they need to make a conscious decision and a wise decision based upon the information that they have. So what are you going to do? So they put me They put me to the task. And so I didn't have any major issues the first round. Second time, to my delight and pleasure, I did not have any unusual side effects, had a little bit of snifflings. Everybody said a sore arm, but I will agree with Dr. Deborah. If you have any underlying conditions or anything that you need to talk to your primary care about, please talk to them so that the decision you make is the best decision for you. And yes, we are glad that Brother Clarence is on the line today, because we're going to ask him. And thank you for being here with us today, Clarence, because I know you've got to juggle a lot of hats, but you are the CEO of the oldest fairly qualified health center in the city of Flint, and you service Genesee County. We talk about vaccine and vaccine availability. Can you help us understand from the perspective of the health clinic, what's up?
Well, good to be with you, Yvonne. We have started vaccinating primarily that 1A group, dealing with seniors primarily, healthcare workers, 65 years and older. And so far, we just don't have enough vaccine to go around. Now, we vaccinated all of our staff, those that wanted it, and I'm happy to hear that both you and Dr. Deborah have gotten the vaccine and have gotten your second shot. I also got my second shot last week, Wednesday, and I have not had any side effects whatsoever. Like you said, Yvonne, just a little soreness in my arm for a day or two, and that quickly subsided. So I think it's far better to get the vaccine, although we had people who were concerned and wanted to wait. And my question was, well, what are you waiting for? And they're saying, well, just I want to wait and see what happens. And I can understand some of the hesitancy, but like Dr. Deborah said, the risks far outweigh you catching COVID. So we are really encouraging people to get the vaccine. Now, we did receive 500 doses last week from the health department. We have given out all of those doses this week, and we hope to get another 300 next week. And I'm happy to say that we have a lot of people who want to get the vaccine. And that's good news, because we want them to get the vaccine. We're hopeful that we can get more vaccine. Now, the new administration came out with their proposal, and in their proposal, community health centers like us will be getting the vaccine directly without having to go through the state or the health department. So we're happy about that. That hasn't started yet, but we are hopeful that it ramps up fairly quickly. Once it does, then we'll be in a much better position to do even more vaccines. But as it stands now, just getting the vaccines in so that we can vaccinate people is our biggest hurdle.
So Clarence, just before we shift to one of our other panelists, the question has come up about what happens when somebody doesn't show up and you've got that vial open and you need to get somebody a shot. Do those shots go to waste?
Well, they could, Yvonne. Now, what we do is we have backups. We have so many doses, and we'll have someone on standby just in case. Now, unfortunately, we did have a couple of staff people who were scheduled for their second dose, unfortunately did not show up. We did not have any standbys for those two. So we did lose those doses, which is why we're making every effort to make sure that we have someone standing by anytime we're given the vaccines. We're doing the vaccines at our three largest clinics, Maine, North Point, and Burton. And we were averaging somewhere around 150 per day. And so as it stands now, that 500 is gone.
So Dr. Deborah, I see you ready to jump in on that one because we don't want any vaccines to go to waste.
No, we do not.
Oh, and I've heard, and I'm curious, Clarence, from your perspective, because it's my understanding for Pfizer, as an example, it comes in bundles of 975. That's the lot that's allotted. And then within each vial, there's 15. And at some places, and because there's a little bit extra in each vial, are actually able to eke out 16 and sometimes even 17 doses out of that vial. I saw a great article in the New York Times where this, software developer developed a system pooling all of the vaccine availability in the city of New York. And I actually sit on their task force in 2 weeks, and for $50 developed a system where by the end of the day, anybody that had leftover doses could just go in and say, this is what we've got. And anybody who was in category 1A or 1B who wanted it could access it. So I'm curious about it. Maybe this isn't a question for you, maybe it's a comment. What would it take for us to stand something like that up in Flint? Because I know you guys are doing the heavy lift of making sure that we get this into people's arms fairly and equitably. But the reality of it is we have a lack of infrastructure to support you being able to do that well. So I just, bravo for the work that you're doing. And I will now be looking myself to see what resources we have locally to be able to help you all bridge that gap, you and other providers. Because I've heard the stories of people having to throw away a few doses because at the end of the day, once it's thawed out, you got to get it into people's arms or those vaccines get thrown out. And we clearly don't want that.
No, we do not. Now we have the Moderna vaccine, but kind of the same type of situation. So
that comes in bundles of 100, right?
Yes.
Yeah.
Right.
Yeah.
And like you said, once you get it out, you has to get it in arms as quickly as you can, or it could unfortunately spoil. So we would appreciate any support we could get, Dr. Deborah, to help us with this.
Yeah. And so it's really important that if you are in line and you got that first one and you really need that second one, don't miss that appointment because it is really important. Because if you miss that appointment, somebody else could have been in that spot. And there are people, I know we talk a lot about vaccine hesitancy, and Dr. Woolford, I want to ask you to chime in here. I know we talk a lot about vaccine hesitancy, but I have really found that people are more open to this vaccine than I thought. Earlier, we talked about risk. And so it's something to really think about. And I know we're all concerned about what's good, bad, and indifferent about it, but it's really an important conversation for us to have. Dr. Woolford.
No, absolutely. Because I think we have to take into account what we know. We realize things are changing over time, but there's some things that we know. We know that vaccines protect against illness. We know that these vaccines protect very well against illness. And so it's important to also know that vaccines don't tend to have problems years down the line. If a vaccine is going to have a problem, it has it within the first couple of months. So what you want to see is that this vaccine has been given to large numbers of people. And if that has happened and you've had a couple of months to see what happens and not much has happened, you can be fairly sure that this is very safe. And in this circumstance, now we have millions of people who have had this vaccine and very few problems. So those who have been waiting maybe to see, I think we have all the information that one might need to feel really quite confident that this is a safe step. Again, of course, if there's unique situations, one should speak with one's doctor, but that information, I think, should encourage us to feel more comfortable getting out there and getting the vaccine.
Yeah. So thank you for that, Dr. Woolford. And we've got a couple more minutes in this little segment, and Dr. Reynolds is going to come back because CDC has given some additional guidelines. But the one thing that I thought a lot about was risk. And I've talked to a lot of friends and colleagues about this. But if the risk of potentially getting the virus and not surviving, the risk of potentially getting the virus and ending up, as Dr. Deborah said earlier, with some long-term illness that you may never recover from, it's quite daunting. So you have to think about the risk and benefits of getting the vaccine and make that decision that's best for you. Dr. Reynolds, what about these guidelines from CDC?
All right. The CDC has said that someone who has had both shots does not need to quarantine, but that deserves significant clarification because you've heard us say before, everything you did before you got the 2 vaccines, you continue to do after. Vaccines reduce the risk. They're very effective, but you still must protect the people around you by washing your hands, wearing a mask, physical distancing, avoiding crowds. These are things that you must do. Now, the headlines on the news was people who had the 2 vaccines don't need to quarantine. Hold up, wait a minute. You still need to do everything you did before vaccination. However, if you come in contact with someone 2 weeks after, listen carefully, your second vaccine, the CDC plus a couple of other conditions talks about what you do under quarantine. So 2 weeks after your second dose, that's 2 weeks, have to pass. All right? They're within 3 months of their last dose. So don't think because, okay, the 2 weeks have passed, I never have to worry about quarantine again, because to be careful and to reduce risk, the CD is saying, but if it's 3 months afterwards, you still need to go into quarantine. Are you following me on this? So let me go back to the original message. Whatever you did before the vaccine, continue to do after the vaccine. And if you have a question, ask somebody. There's a 2 week after, up to 3 months after window where you may have some flexibility, but you better ask somebody because that information may change now that we have variants out there. Okay, and when I say variants, I'm talking about changes in the virus that may, and I'm not saying definitely do, but may affect the effectiveness of the vaccine. And then there's another important part of this message. If you have COVID-19 symptoms, anytime you need to go into quarantine, okay? And so reconsider your position because sometimes after 3 months, maybe you should start getting tested regularly again. And before the 2 weeks, if you have a concern, you need to get tested again. Because we've been talking about vaccine, but we need to talk about testing also. So to reduce risk, everything you did before the vaccine ever came out, continue to do.
Okay, so we're back to the Swiss cheese that we heard about a few weeks ago, making sure that we continue that. So more to come. There's a lot that we need to talk about, but we're going to shift a little bit. I want to thank our panel this morning or this afternoon for participating in the roundtable. Dr. Woolford, Dr. Furholder, Brother Clarence, I call you Brother Clarence, and Dr. Reynolds, I'm going to call you Dr. Clarence today. All these doctors for being a part of this wonderful roundtable. And just hold on to your hats because we are going to give you some more information. Dr. Deborah is going to first come. Excuse me. I'm getting a little bit ahead of myself. We need to hear from Brother Gary Jones. Brother Gary Jones is going to talk to us about what's coming out of the governor's office. We want to be sure that we're clear. Governor's giving us some instructions and guidelines. So Brother Gary, help us to understand what's coming out of the governor's office this week.
Absolutely. Thanks, Yvonne. And good afternoon, everybody. So Governor Whitmer yesterday released her third executive budget. This budget is centered on equitably growing the state's economy by expanding skills training and childcare for families, providing a further down payment on rebuilding the state's crumbling bridges and water infrastructure, and helping small businesses recover from the pandemic. The budget recommendation totals $67.1 billion. To learn more about how the budget impacts you, or your organization for that matter, visit www.michigan.gov/budget. Also, the executive budget recommendation follows a recent supplemental budget request for the current fiscal year that was sent to the legislature, which will provide $5.6 billion in new funding for Michigan's recovery from the pandemic. That supplemental request still requires action by the legislature to ensure the full benefits of Governor Whitmer's COVID recovery plan are realized. A recent study by Duke University and the National Governors Association Center for Best Practices found that the governor's Coronavirus Task Force on Racial Disparities, which was led by the Lieutenant Governor, Garland Gilchrist, and also Dr. Furholder, too, as well, was a part of that Coronavirus Task Force. The study showed that it has made significant and substantial progress towards its goal of reducing health-based racial disparities associated with the COVID-19 pandemic. Also recently, the governor and the Department of Insurance and Financial Services announced that the state has secured agreements from nearly all of the state's health insurers to extend their commitments to waive all out-of-pocket costs for COVID-19 testing, vaccinations, and treatment. Also recently, it was announced that Michigan got an $8.3 million boost in its efforts to distribute the COVID-19 vaccine. This funding is an advance payment to MDHHS for costs for a public information campaign focused on statewide vaccination efforts. The campaign will inform the public about the COVID-19 vaccination safety, COVID-19 vaccination sites, hours of operation, and the registration process to get the vaccine. Also recently, the governor, MDHHS, announced that the state has gained federal approval for a second round of pandemic EBT benefits. Approximately 810,000 Michigan children whose access to nutritious school meals has been affected by the COVID-19 pandemic will receive $741 million in assistance benefits that their family can use to pay for food at stores or online. Also, approximately 350,000 Michigan families will continue to have access to additional food assistance benefits during February as a response to the COVID-19 pandemic. This was a recent announcement by MDHHS as well. And lastly, older adults in Michigan experiencing challenges finding COVID-19 vaccine information online now have a trusted source for assistance. Through its partnership with the national education technology company Get Set Up, MDHHS Aging and Adult Services Agency is offering a series of sessions to walk older Michiganders through the Michigan COVID-19 vaccination website. The goal is to help them find their local health department to register online for a vaccine appointment or to be added to the wait list. And to give you that website, that is michigan.gov/COVID vaccine. And lastly, the catch-all for coronavirus information for the state is michigan.gov/coronavirus.
Thank you so much, Gary. You always provide such great segues. We appreciate all the information you share coming out of the governor's office. I'm delighted to hear what's happening with that additional money to help with the food insecurity issues that we have. And I think that leads right into your work, Dr. Deborah, talking about equity. If there isn't access, if there isn't a little bit of extra oomph in there, we won't ever get to equity. So we're gonna ask you now to give us an update on the health equity brief and help us, because I think you were on that task force that helped support that kind of legislation.
Yeah, so we got great news in Flint and Genesee County. We continue to show declines in case counts and in deaths. This is our 11th consecutive week. I'll show you what that looks like in a sec. Our community case rate is at an all-time low. We are the lowest that we have been really since the outset of this pandemic. Our community case rate is currently 3.4%. It was 3.5% last week. That difference is not a big difference, but the point is we're going in the right direction and we're keeping that case count low. So testing remains high. And what that means is among the people who are getting tested, the majority of them are coming back negative. So our prevention measures are working. So we want to continue now to build out the data infrastructure to keep that going. And here's what it looks like. You can see we're even getting better in that race unknown category of getting that data backfilled so that we can actually say with certainty that not only did we close the gap, but that the gap remains closed. So this is good news. We're only showing you the last 5 weeks. If you want to see more, you can go into the county's website, gchd.us/coronavirus. So what is our fabulous, wonderful health department doing? They are innovating like crazy. Big time innovation is happening. They are now integrating and prioritizing people based on risk and social vulnerability. So there's this really robust measure called the Social Vulnerability Index, right? We've heard a lot of pushback from people who said, well, you know, we really need to stick with the categories 1A, 1B. Are we doing the good job of vaccinating our frontline healthcare workers and our people in long-term care facilities and our very precious senior population? We all know that the lion's share of our deaths, about 80% nationally, were in adults age 55 and over. And so our wonderful new health officer, Dr. Pamela Hackert, has said we're going to bring even more science to bear in this process to ensure equity. And we use this very robust measure developed by the CDC called the Social Vulnerability Index. It looks at socioeconomic status, household factors. It does integrate minority status, including language barriers for people, as well as housing type and transportation. The whole goal here is that we want to make sure that the people who are at highest risk for both contracting the virus as well as a bad outcome have priority access to the vaccine within those categories. Okay, so this is all good news. Here's what spread looks like for us. With that social vulnerability index, the areas that are the darkest purple are the areas that are higher priority. So we're trying to bring more sort of resolution, if you will, more thoughtfulness to figuring out how to deal with this now bottleneck. We've got so many people on the wait list. I heard the stats about a week ago from the health department, and the wait list at the time was about 30,000 people long, and it was growing by 2,000 people a day. So we're trying to be more thoughtful about how to prioritize people who are on that list to get the people who need it the most at the front of the line. Spread in the county looks super great. It's thinning out. The darker the color, the deeper the spread. And you can see from December to January, it's lightening up. And that is a full-blown function of the great work that we've been doing and the great work that's been happening. So I'm gonna pass the mic now to my fabulous colleague, Mary Catherine Crawford, who is the author of this brief. She's gonna give you the 3 W's, because you gotta still, like Dr. Reynolds said, even if you've been vaccinated, you have to still honor the protocols. And she's gonna talk about recommendations for policymakers. I'm gonna pass it over.
Great, thanks, Dr. Furholder. So I know you just mentioned the 3 W's. So wear, wash, and watch. Wear your mask, wash your hands, and so sorry, can you go ahead and flip to the next slide? Oh, so if you have any questions about the brief at all, you can go ahead and just shoot me an email at cr8wf457@msu.edu. And then I'm super excited to talk to you about our recommendations for our policymakers. So we're really calling on our policymakers of the Genesee delegation to advocate for the immediate release of federal COVID funds that are already available and essential for the welfare of all Michiganders. In addition, we also believe that we're recommending that vaccine administration strategies that prioritize these populations in zip codes high on the social vulnerability index. That really should be mandated so that we're not forgetting about anyone in our community. We also need to heavily promote the reopening of the Affordable Care Act's markets in order to reduce the growing number of uninsured individuals and improve access to care, because we know so many have lost their health insurance throughout the pandemic. And we also need to continue to safeguard existing policies that promote equitable care. Great, thanks, Say. So if you want to help with COVID response and recovery, you can go to Genesee County Health Department /coronavirus for more info and volunteer opportunities. And you can also simply help stop the spread just by downloading and using the My COVID Alert app to get exposure notifications and just know your risks so that you can take appropriate measures, whether it's testing or quarantining after exposure. And if you have any questions about the data, you can go ahead and contact my colleague, Rick Sadler. His email is sadlerr@msu.edu.
Thank you, Mary Catherine. I appreciate the work that you're doing on this. And I want to remind you right now, if you have questions that you want to put in the queue, please do that and we will get to your questions. Our panelists are in the background. I do want to read for those of you that may not have the opportunity to actually see the questions in the queue. We have one of our listeners say, I am scheduled for my second vaccine dose on the 27th. And remain committed to getting the complete vaccination series. The risks are too great to even think about. I don't want to get sick again and go have anything like I experienced 90 days ago. In addition to having a very sore left arm, I did have a brief reoccurrence of symptoms that reminded me of what I felt like 3 months ago. I don't want to get reinfected or infected by any one of the variants. I want all of us to be healthy and stay healthy. So that's encouraging from one of our participants. I'm going to ask our panelists, please. There are some other questions in the queue, and we're going to answer them hopefully before the end of the session is over. And I'll come back with a couple more questions. Dr. Susan Wolford, she talked a little bit in the roundtable, but she also shared some very important information with us last week about the variants and the mutations. Now, there are some questions, Dr. Wolford, in the queue about this. So I hope that your presentation will answer them. But if not, we're going to come back and ask you directly these questions. So Dr. Wolford?
Sure. Thank you so much, Yvonne. So one of the questions that was asked was, what is the difference between mutations and variants? Because we hear both words, right? So to get to that, we have to think back about what a virus is. So a virus, as you remember, is just this sort of fatty layer on the outside with that genetic material, that RNA, which is like the recipe in the middle that tells the virus, well, tells the molecule how to make the virus. And so what viruses do is that they multiply, they make copies of themselves, just many, many, many copies. That's what they're doing in our bodies. But when they make these copies, sometimes they don't make the copy very well and they make mistakes. The mistake is the mutation. So the mistake is a mutation in that recipe. So here you see the recipe calls for 2 green dots, and in the copy, it put 2 blue dots. That's the mutation. And now the virus that has that mutation in it is what we call a variant. And that variant, you can call it whatever you like. We could call this one the 2 blue variant. So it makes more copies, sometimes makes more mistakes. You see here, it put pink ones where it shouldn't have. And so we have now a mutation, and the virus that has that mutation in it is called the variant. We're going to call that one the double pink variant. So that's the difference between a mutation and a variant. You're on mute, Yvonne. I think you're asking me something, but
I'm asking you a question. I really am. When we look at these mutations and variants, why does it matter that we understand this?
Right. So that is really key. When we think about the coronavirus, here we see it with its RNA, its recipe in the middle. Its recipe makes a virus that has spike proteins on the outside. And so to understand what's going on with these variants, we have to think a little bit about that spike protein. So what that spike protein does is it's like a key, and it is able to unlock the locks on outside of some of our cells. These little receptors on some of our cells, particularly in our lungs and our respiratory tracts, have locks that this spike protein can unlock. And so what happens when we have a variant, you see if we change that recipe and, for example, put the 2 pink dots instead, that recipe changes something about the virus, or it can change something about the virus. In some cases, it can change what that spike protein looks like at the end there. And so now, rather than a key that kind of can just sort of jiggle and open up the lock, this variant has made a key that can really open up the lock very easily. It's a great fit. And so it opens up that cell very well and lets the virus get in. And that's what's happened with the variant from England, the B117 variant. it changed the end of that spike protein so that it was better able to open the locks on our cells and better able to get in and do its damage.
So Dr. Wilford, I got to ask you this. Now we're looking at this and many questions. I'm going to couple questions together. One of our participants says that they heard that the vaccine does not prevent the spread of the virus anyway. So what's the use in taking it? And then, is there proof that the vaccine will work on these variants?
So that's a really good question. And we're going to take those two things together. So let's think about how vaccines work, right? Now, remember, we've said before that vaccination is like a self-defense training camp, a boot camp to learn how to fight back against the virus when we really come in contact with it. So we do some training ahead of time so we're ready to encounter it when it happens. So the way this happens with the vaccines, at least the two that we have out at the moment, is when we get the vaccine, it puts into our body this messenger RNA recipe, this mRNA recipe for the spike protein, not the whole recipe for the whole virus, but just the part that codes for or gives the instructions for the spike protein. So it's important. So you cannot get COVID from the vaccine, important to note, because it doesn't give the recipe for the whole thing, just for the spike. And that goes into the outer part of our cell, and it causes our cells to make the spike protein. And so then our cells have the spike protein on the outside, and our body says, whoa, that's not what's supposed to be there. Let's make some antibodies that can fight it. And those antibodies are made to fit specifically over the end of that spike protein. And our body learns how to make that so that we have the practice in making these antibodies, so that when our bodies now come in contact with the actual virus, the coronavirus, and it's trying to get into our cells, our bodies can very easily make that antibody right away to block it. So now it can't open the lock. So then you ask about the variant, right? What happens if we have a variant? So let's say we have the 2 pink dot variant there, which changes the tip of the area that unlocks the receptors, unlocks the lock. Will the vaccine work as well? Will the antibodies work as well? Well, what we have found out about the current variations, some of them, like the one from Britain, is that the antibodies still are able to attach and still are able to block it. So while the variants might make it fit, the antibodies not fit exactly as well as they did, they still work well enough to protect us to some extent. So it's important to note that there's a range of things. One can get infected and have some virus in your body, but then one can get all the way to getting very, very ill and severely ill and dying. The vaccine protects against that. So while we don't know whether or not you might still get infected, we do know it impacts and prevents you from getting severely ill and dying. So even if you got infected, it would be better to have the vaccine so you don't have the severe impact and die. And finally, we have to keep monitoring, we have to keep checking to see how those variants are changing that spike protein, because you could get some changes that mean that the antibodies don't work that well. But we'll know that as we keep checking and doing the tests to see how those variants are changing.
Yeah. Thank you, Dr. Wilford. It kind of reminds us of where we started at the top of the hour when Dr. Reynolds was talking about the African-American woman in Grand Rapids who isolated the variant for pertussis. So it's an ongoing study. So I just want to make sure that we are thankful that you're giving us this information and all of our team for helping us to know how this is working. I want to just go quickly back. You can go to the next slide, but Tay, but I want to ask Clarence if he could just respond to a question, if he can come off mute, and maybe even Dr. Reynolds, you might want to chime in here, Dr. Deborah. One of the participants says they've registered for over 2 weeks ago, and still have not received an appointment. How long is the average time, or average wait? And if they're 65, they are 65 and older, she and her husband, and is there somewhere they can check to see where their registration is? I think this is a question that many people are asking. I see Dr. Reynolds, I see your hand. Please come off mute and help us.
Yes, there is no average wait because we don't know what the wait time is. It is all dependent on the delivery of vaccines. So once a site uses up its vaccine, that's it. They put in an order for more vaccine, and they do not necessarily get the number they ordered at this time. And I'll just be blunt and say what was said under the old presidential administration was not accurate. There was not enough vaccine. And right now we're trying to produce enough vaccine so that we will know when you get an appointment. We can tell you when that will happen. Right now, we can't think beyond a 1 to 2 week window. So once that vaccine delivery is over and the supply is administered, it's impossible to give an appointment. The next layer of development is actually setting up an electronic database and appointment system to accommodate the demand. Telephone won't do it. So unfortunately, there's no way even my wife can call and find out when her appointment will be. So that's the way it is right now.
Clarence, thank you, Dr. Reynolds.
Yes. Now, the way we try to work is we know how many doses we have, so we schedule enough patients that will address those doses with some additional patients in case somebody doesn't show up. But like Dr. Reynolds said, at this point, in our case, let's say we had 500 doses. Well, we schedule 500 patients who are on our list with some extras just in case. But once that runs out, then whoever else is on the list is going to have to wait. And there's no way of knowing when we're going to get that next batch in. So it's kind of up in the air right now in terms of the scheduling. But when we get the doses, we call the patients and let them know who is actually scheduled. Now, they will get the doses. When we schedule a patient in, they will get the shot. It's only those who decide not to show, and then we have to quickly call someone with no notice to come right in and hopefully get that dose before it spoils.
Thank you, Clarence, and thank you, Dr. Reynolds. There are more questions in the queue. Our panelists are answering some of those questions for you. Dr. Wolford, let me thank you again for that presentation about the mutations and the variants and the importance of getting the vaccine. One of the questions that was raised to us on a number of occasions was, what about the economic impact of COVID in our community? And we're fortunate today to have a representative from the Flint, Genesee Chamber of Commerce, Tyler Messler. Thank you. He has been so gracious to come and talk to us as the Director of Economic Development for the Flint and Genesee Chamber of Commerce. Welcome, Tyler. We appreciate you coming on. Help us to understand the Chamber's work in this pandemic environment.
Well, thank you for having me on. And I feel like I am out of my league. What an impressive lineup and just a great information. And I've really enjoyed it. So thanks for having me. And I'm happy to be there here. I'll try to offer something of value. I am the Director of Economic Development at the Flint and Genesee Chamber. Our job is to help companies that have jobs grow and thrive. And if they're not here, come here. And so that's what our role is. Obviously, since the pandemic began, we've really been focused on COVID relief efforts. And I want to talk about a few things that are in the ether right now available. So if you own a business or know somebody who does, maybe this would be a helpful information for them. All this is available on our website at flintandgenesee.org. So if you have any questions or would like to learn more, feel free to visit that website. So the first thing I want to talk about is the Paycheck Protection Program. You might have heard about this program that was enacted with the CARES Act. I have some stats here. The first round of the PPP, they call it, that in Genesee County alone, over $500 million of the PPP program were deployed, and that associated with nearly 60,000 jobs. So when you talk about impact of COVID, lots of impact, lots of companies were affected. Lots of companies, thankfully, were able to take advantage of this program. It was designed to help people to keep employees on the payroll. And if the company uses it to pay people on the payroll, they can get it forgiven. And so it becomes a forgivable loan. And if they use it for other things, then it's a 1% loan. So that's a very powerful tool. And it was recently reenacted. So they call it the second draw of the PPP. And I think on the next slide, I have the second draw of the PPP is now available. It opened January 13th and will close on March 31st. You apply for this loan through your bank. So you can, if you go to the SBA.gov and look up the Paycheck Protection Program, you can find out which lenders are working with the SBA on this, but pretty much all banks are working with this program, and you go to your bank and you work to get a PPP loan. What we've noticed is that people are not totally taking advantage of the second time around, and that might be good news. We'll take the good news that they don't need it. But also it's tax season. So we think people are kind of thinking about taxes and talking to their financial advisors before they take advantage of it, but it does close in March. So I want to just put that on people's radar. So you got the federal program, the PPP, which is very powerful, and over $500 million of that program funneled to our county the last time around, and hopefully more again this time around, and a needed relief. The other thing is the state of Michigan. I can look, there's my son just made a little entrance, so apologize for that. Gordy, you know, the joys of working from home. The federal government is doing their work, and the state government, hey bud, okay, thank you. Okay, thank you. I'm on a meeting. I'm sorry about that. Is doing their work too. And recently, the state announced the Small Business Survival Grant. I'm sorry. The Small Business Survival Grant, and they had $55 million set aside for that. This program just closed. So I don't mean it to say, hey, this is a program you can take advantage of it. But like Gary talked about, the governor has proposed some new programs, and she is working with the legislature to get these things passed. The survival program is a lot like what those grant programs look like. So real quick, $55 million statewide. The next slide is you had to have less than 100 employees. You had to be in an industry that was affected by the order, and you need working capital to pay for rent, mortgage, and utilities. And this is an example of a program that I think that even though the new programs have been proposed and not passed, I think they will look like this. So this is something to keep in mind. There was the next slide, I think, talks about that the applications recently closed and the awardees will be announced in March. So the next slide is, these are the programs that were proposed by the governor: the Michigan Main Street Initiative, the Michigan Micro Enterprise Support Initiative, and Business Accelerator and Resiliency Initiatives. And these are all grants to help stabilize and support small businesses. Main Street are thinking about like those downtown restaurants or retail spots, places that are vital to our communities. The enterprise is about small businesses that are looking to continue to grow, and then the resiliency initiative. So high-tech companies. So these are coming down the pike. Again, more information on our website at flintandgenesee.org. And I'd be happy to answer any other questions about it.
Thank you, Tyler. For people who have these small businesses, and if you're listening, and maybe you can share this information with a friend, but we want you to be sure to get in touch with Tyler at the chamber. They can call you directly, Tyler.
Yeah, or
just give us your contact information once again.
Yeah, well, I think I have a long last name that's really hard to spell, so the email's not great. But what I would tell you is go to our website at flintandgenesee.org. And on there, there's a thing called the Small Business Help Desk. And that will get us in contact directly with me or my team. And it's an easy way to get in connection with us. But if you want to, T. Ross Messler at flintandgenesee.org. If you remember that.
Thank you, Tyler. I think that someone's going to put it out there in the chat for us so we can all get it. But we appreciate you coming on today. I know that we've done a lot of talk about vaccines today, but it is important when we talk about putting a local context to this pandemic. It has affected our small businesses. And so our small businesses affect our lives. And so we want to encourage you, if you know someone who owns a small business, have them just stay in touch with this department. So if and when opportunities come forward, they will know how to apply for them. We're going to go quickly now to some announcements for you today. We're wanting to make sure that we all remember, as we've talked about today, there are still COVID testing sites available. In the earlier conversation, Dr. Reynolds mentioned when he was talking about quarantine, he also mentioned the importance of still getting tested. We want to understand that even if you are getting the vaccine, you still need to maintain those protocols. And if you're exposed, you do want to get tested, and there's a protocol for that. So the Genesee Health Systems, along with the Genesee Community Health Center, has free COVID testing. It's no cost COVID testing, which means not out of your pocket will you pay anything. They may ask you for your insurance, but that means the insurance will cover it, but you do not have to be prohibited from going if you need to get testing. They are located on Center Road in Burton. That's 2298 Center Road in Burton. They are doing both the viral testing and the rapid testing. So if you need to get that information, it's in the webinar, but please go and get yourself checked if you need to do so. They would like you to bring your insurance card. We also want you to know that the other testing sites that have been open and available continue to be open. If we use them, we have the great opportunity of maintaining them. So Word of Life Church still available at 460 West Atherton Road, Tuesday, Thursdays from 12 p.m. to 6 p.m. Then we also have Bethel United Methodist Church at Ballinger Highway from Tuesday, Wednesday, and Thursday. Tuesday, Wednesday from 10 to 4, and Thursday from 1 to 7. And finally, Macedonia Baptist Church on North Saginaw Street, G5443 Saginaw Street. They are Monday, Friday, and Saturday from 10 to 3. We also want to remind you that we appreciate you coming every week to the webinar. CEUs are available for our community health workers. And we thank you for joining us and being on, listening, and getting those continuing education units for the work that you're doing. We appreciate you and encourage you, continue to like us on Facebook. If you haven't liked us before, go to that www.facebook.com/HFRCC and like us on Facebook. Please subscribe to our YouTube channel, Healthy Flint. And then, of course, as we tell you every week, you can email us any questions that you might have, or if you want more information at info@healthyflint.org. You can also call us at 810-835-2130. I have a minute left, and I want to just thank all of the co-directors of the Healthy Flint Research Coordinating Center. And I'm going to call you by name today. My co-director for the Community Corps, Ms. Tanya French Turner. For Michigan State University, Dr. Deborah Furholder and Dr. Rick Sadler. University of Michigan Flint, Dr. Ken Sylvester and Dr. Karen Stokes. At University of Michigan in Ann Arbor, Dr. Susan Wolford and Tricia Protowski. We thank you for all the commitment that you've made for these last 48 weeks. We have a few more to go before we hit that 50 or that century point, but we are excited that you, the community, have joined us every week asking these questions. We've got a couple more in the queue. Our panelists are typing even as we speak. If we don't get to it today, it's because we need to follow up with the health department, particularly on one of those questions, so that we can respond appropriately for you. Let me again thank you for joining us today, the 48th webinar, the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center. Thank you, and join us again next week